Hello everyone, my name is Samantha Stam and I'm a member of the HOA, a group from the Medical Microbiology class of spring of 2024 here at the University of Wyoming. Today, my group members and I are going to be covering the topic of neonatal sepsis, a deadly infection of the blood found in newborns. For my section of this presentation, I'm going to be explaining what neonatal sepsis is. I'll be doing this through defining neonatal, talking about the types and severity of neonatal sepsis, and talking about some of the developmental factors of neonatal sepsis. So what is neonatal? Neonatal is defined as the first month or about 28 days after birth. During this time, children are at the highest risks of death, and it has been recorded that more than 40% of all deaths in children under the age of 5 occurred during this neonatal period. Moving into types and severity, there are two types of neonatal sepsis. Early onset neonatal sepsis, also referred to as EONS, and late onset neonatal sepsis, also referred to as LONS. Early onset neonatal sepsis is defined as infection and sepsis within the first 72 hours of life. And late onset neonatal sepsis is defined as infection and sepsis after the first 72 hours and up to the first month of life. I do think it's important to note that a lot of literature really varies on the definition and time period of EONS versus LONS. EONS can be seen being defined anywhere from the first 24 hours to the first week of life, and LONS can be seen being defined anywhere from after that first 72 hours and up to the first month of life. But generally, EONS does stick to that first 72 hours of life, and LONS is usually defined as after that first 72 hours and up to the first month of life. Severity really depends on two main factors. These include the types of bacteria, which will be discussed later in this presentation, but also birth weight and premature birth. Premature birth is anything less than 37 weeks of gestation. This early birth can increase the severity of infection because the neonate is generally weaker and its immune system is less likely to be able to fight off the infection. Moving into birth weight, low birth weight is considered anything less than 2,500 grams. Very low birth weight is considered anything less than 1,500 grams, and extremely low birth weight is considered anything less than or equal to 1,000 grams. As you move down in weight, the severity of the infection often increases. Now we're going to discuss some of the developmental factors of neonatal sepsis. EONS is often associated with vertical transmission of pathogens from mother to child. Vertical transmission is the passage of bacteria from mother to baby before or during delivery. LONS is associated with iatrogenic infection, which is misdiagnosis or a state of ill health, and also nosocomial infections, which is infection acquired while receiving health care. These nosocomial infections can be associated with central venous catheter use, which is a long, thin tube inserted into a vein, which is usually below the collarbone. It can also be associated with other invasive medical devices. Within the neonatal field, this often refers to any type of intravascular devices. Intravascular devices are devices situated inside of a blood vessel. These include use of umbilical catheters, which are inserted into the umbilical vein in the abdominal or stomach area, and also peripherally inserted central catheters, which are inserted into the arm. Prolonged hospitalization can also increase the risk of getting neonatal sepsis because of the increased risk of being exposed to these pathogens and bacteria. Within developmental factors, there has been a pattern seen of greater incidence of neonatal sepsis in male full-term infants than in female full-term infants, although through our research we cannot find much information as to why this pattern occurs. Greater than 3 vaginal examinations during labor does increase the risk of development due to a greater chance of exposure to pathogens. Fever or infection in the mother during labor also increases the risk of development because it does indicate a pathogenic or bacterial infection that the mother then can pass on to the baby. Studies have shown that there's a greater likelihood of the development and death from sepsis in children in low-income backgrounds. This often occurs because of the lack of access to prevention and treatment for neonatal sepsis. That's all from me, guys. Next, Savannah will be taking over to talk about the history of neonatal sepsis.
Hi, my name is Savannah Starr, and I'm going to be discussing the history of neonatal sepsis. I'll start by discussing some discoveries and scientists who were influential in shaping our understanding, and then talk about the progression of treatment and management over time. First, we have the discovery and influential scientists. The idea of sepsis was introduced early on by the Greek physician Hippocrates, who viewed sepsis as a dangerous decay that could develop in the body. He then started to explore the different pharmacological responses to this condition by looking at the antiseptic properties of wine and vinegar. Antiseptic properties of a substance can be described as their ability or role in stopping the spread of bacteria and other microorganisms. In the 1800s, a notable scientist was Dr. Ignaz Semmelweis, a Hungarian obstetrician who focused on sepsis in newborns and mothers by observing the rates of occurrence in different hospital wards. He noticed that those assisted by midwives had around a 2% occurrence rate of sepsis, while those assisted by doctors and medical students had an occurrence rate of about 16%. He learned that med students and doctors would deliver babies after performing autopsies without washing hands in between, spreading bacteria. He quickly enforced rules on hand washing and saw a drastic decrease in sepsis to about 3%. He made 3 conclusions. Because childbed fever, or infection following childbirth, and neonatal sepsis presented so similarly, they could both be described by the term puerperal sepsis, sepsis following childbirth, and apply to both mother and baby. Second, current and past theories detailing how newborns and mothers caught sepsis in the same manner, a common theory being overcrowding, were inaccurate and insufficient. Third, he proposed that bacteria or particles from cadavers spread from doctors and medical students were likely the cause of both childbed fever and fetal sepsis. Lastly, I want to mention a few additional scientists. First, we have Louis Pasteur, who developed the germ theory of disease, which explained how microorganisms invade the body and cause illness and disease. Second, we have Joseph Lister, who developed multiple antiseptic methods that help manage the spread of bacteria and resulting infections. Both of these helped increase our understanding of sepsis and its spread. That brings us to the progression of treatment and management. In earlier times, sepsis was often considered lethal because of an underdeveloped understanding of the topic. However, there were different techniques that patients and doctors followed for prevention and management. Healthy hygiene and nutrition practices were recommended to decrease the risk of sepsis and to make the body more able to fight it off. Hospitals tended to have a higher rate of sepsis following birth, so many women opted to give birth at home to minimize their exposure. And lastly, hygiene and antiseptic techniques were being developed to lessen the occurrence and severity of sepsis. That brings us to modern care. Antibiotics as treatment will be talked about more later on, so for now these are just additional methods of care that help manage symptoms and side effects. I want to note NICUs, or neonatal intensive care units, as they prove to be especially important in the treatment and management of neonatal sepsis and other conditions in newborns by making different methods of care available in one specialized place. Some of these methods include administering IV fluids and antibiotics, oxygen and respiratory support, nutritional support, incubation to maintain temperature, and overall advanced monitoring, including oxygen, heart rate, blood pressure, and any other important aspects of health. Next, I'll hand it over to Lola to talk about causes.
Hi, I'm Lola Wozni, and I will be discussing the causes of neonatal sepsis. So this portion of our presentation will include the types of bacteria that influence sepsis in neonates, as well as the early onset causes and risk factors and the late onset causes and risk factors. Okay, so types of bacteria that can cause sepsis in neonates include E. coli, which is a gram-negative rod that anyone with an education or background in microbiology should be familiar with. Another one is Haemophilus influenzae, which is also gram-negative. Listeria monocytogenes, which is a gram-positive rod. Coagulase-negative staphylococcus, also known as CONS, and Group B streptococcus, which is also known as GBS. So something to know about these bacteria is that they are all normal flora, which means that they are all found in the human body of healthy individuals. However, as soon as these bacteria are ingested or contaminate a part of the body that they're not normally found in, they are prone to causing infection. Neonates are extremely susceptible to obtaining infection because they do not have a fully developed immune system to fight off unwanted bacteria. Something specific about CONS is that it has the potential to develop biofilm, which can cause infection when a catheter is in use, and I will talk about this more in detail in a few slides. Overall, it is important for mothers to take care of themselves. This includes conducting proper hygiene and also just being aware of the food they ingest. And also, it's important for hospitals just to maintain sterile technique to try to prevent these infections from happening. Moving on to early onset causes and risk factors. Early onset factors mean that the bacteria is transmitted from the mother to the neonate. These factors do not include bacteria that can cause contamination from the environment outside of the mother. So first of all, GBS, which I mentioned on the last slide, can cause infection to an infant when it is colonized within the gastrointestinal and genital tracts of the mother. Pregnant women are often screened for GBS weeks prior to delivery and can take antibiotics if there is a concern that will cause invasive disease. As I previously mentioned, neonates are more susceptible to infection due to their immature immune systems. Specifically, if they are born prematurely, their immune systems are significantly weaker. Infection of the amniotic sac and placenta tissue can directly infect the fetus, and it can also cause premature birth. Neonates get their nutrients through the placenta, so if its tissues have been infected with pathogens, the neonate is being directly exposed to these pathogens as well. Rupture of the amniotic sac, also known as water breakage, increases the risk of neonatal infection because it serves as the protective barrier between the fetus and its exterior. Bacteria from the vagina and cervix can then contaminate the amniotic fluid, which could cause infection, especially when the fetus is exposed to this bacteria for a long period of time. It's important for healthcare professionals to be monitoring the patient after their water break so that they can take the necessary precautions in ensuring the health of mom and baby. This can also lead to preterm birth. Finally, neonates are at severe risk of developing infection when the mother has a history of or is currently contaminated with herpes simplex virus. Infants are susceptible to becoming infected with herpes prior to, during, and immediately after delivery. Infants born from a woman with active genital herpes lesions are at high risk of developing infection leading to sepsis. They can also acquire herpes through breastfeeding. So all this to say, neonates that acquire infection from bacteria transmitted from their mother are at high risk of developing neonatal sepsis. Finally, I will be discussing the late onset causes and risk factors. These are different from the early onset factors because these are caused by pathogens surrounding the environment of delivery and care during and post-birth. So one of the risk factors is if a catheter is in an infant's blood vessel for a prolonged period of time. Catheters allow for bacteria to directly enter the bloodstream without interacting with the body's natural defenses prior to. So proper catheter care is extremely important to prevent direct infection as well as biofilm production. Biofilm it develops when bacteria stick together on a surface, creating a sort of web containing bacteria, which can prevent the immune system and antibiotics from fighting it. And finally, infants that spend a prolonged period of time in the hospital are susceptible to an increased risk of developing infection because they are in an environment contaminated with pathogens all the time that can be harmful, and some of which cannot be treated with antibiotics. So those are some of the causes of neonatal sepsis.
Hi, I'm Madison Desert, and I'll be going over the symptoms and diagnosis of neonatal sepsis. I'll be talking about the biochemical testing that is performed for this, the categorical symptoms, and the prognosis. According to the National Library of Medicine, the most common tests performed on infants to identify neonatal sepsis are these three. We have a complete blood count, or CBC, which will help determine the white blood cell count. Low white blood cell counts indicate higher susceptibility to infections, more helpful for identifying non-infected newborns instead of infected newborns. This test can also show what the red blood cells look like, which will help with further identification. The next test is the C-reactive protein, or CRP. This is a protein produced by the liver in which high levels indicate sepsis. Results for this test normally take 24 hours, so it isn't great for early detection of the disease, which is what is needed for this. But it can be helpful for a definitive diagnosis. Normal levels for infants are between 2 and 5 milligrams per liter, so anything higher than that is likely an indicator for sepsis. The last test is procalcitonin, or PCT, which is a hormone responsible for vascular and inflammatory response. PCT levels can be high in cases other than sepsis, so it can sometimes be inconclusive, but completed with the other two tests will show a likely diagnosis of sepsis. The symptoms given by the Cleveland Clinic are fever or low temperature, fast or slow heart rate, fast breathing or shortness of breath, vomiting, diarrhea, difficulty feeding, swollen abdomen, and cold hands or feet. These symptoms are mostly generalized and contradict each other, so they could indicate many other things than sepsis. If the infant has more than 3 of these things together, it is likely that they have sepsis. Neonatal sepsis is the leading cause of infant death, but when they beat the infection, there's a very high chance of full recovery. Getting treatment fast plays a big role in the outcome, so early detection is extremely important. The tests mentioned above help with this. Newborns are very resilient, but because they are still developing, the sepsis could cause permanent damage. Complications include meningitis, cerebral palsy, seizure disorders, and hearing loss, which are all very detrimental to the child's development. Later in the presentation, we'll go over more on mortality. Next, Emma is going to talk about treatment.
Hi, I'm Emma Van Rokel, and I'm going to be talking about the treatment portion. So this is going to include antibiotics that are used for neonatal sepsis, lengths of treatment, and mortality rates for neonatal sepsis.
So recently there's been an issue that has arisen with the antibiotics used to treat neonatal sepsis, and it's that the bacteria that cause sepsis have become resistant. Now, these bacteria can be S. aureus, E. coli, and then a lot of the Klebsiella species. And now the antibiotics that we do use against sepsis are going to be ampicillin, amoxicillin, benzyl penicillin, and then aminoglycosides. And those are just a couple. But around 40% of these pathogens were resistant to that first line of antibiotics, which are some of the ones that I read off to you. And then when you look at the chart down in the left corner, it's going to show you some results that were given from a study of 206 neonates that were given these antibiotics, and then there is the frequency and percentage of the amount of neonates who received those antibiotics. Okay, so this is the section on length of treatment, and I'm using the same sample size from the last slide of the 206 neonates, and they had a hospital stay of around 325 days. And one of the examples given was that a treatment used was the antibacterials gentamicinin mixed with benzyl penicillin or ampicillin, and it was administered for at least 7 days. It could be longer, it could be shorter, depending on how severe the sepsis was. And then at the bottom there's a chart that shows certain things that can vary the baby's stay in the hospital, and some examples of that are if the baby has drug therapy problems, then they're likely to stay 2 days longer in the hospital. And then another is the way the baby was delivered. So if it was delivered SVD or spontaneous vaginal delivery versus a C-section, then they stayed for 2 or 3 days longer if they were birthed via SVD. And the important part is to kind of just like get these babies out of the hospital as soon as possible, because they already have a weakened immune system and we don't want it to get worse. We don't want them to get sick than they already are with the sepsis and being newborns. Okay, now on to a really difficult topic, mortality. So there are a lot of factors that go into the mortality rate for neonatal sepsis, and it's actually one of the third most frequent types of neonatal mortality. Now, about 3 million sepsis cases happen per year, and 400,000 to 700,000 of those cases end up in death. Now, there are a couple things, like I said earlier, there are a couple things that go into if a baby who contracts neonatal sepsis dies or not. And one of these is PROMS, which is premature rupture of the membrane. So about 37.9% of moms experience PROMS, and this is something that this is a factor that can lead to neonatal sepsis. And then neonates who had multi-drug resistant sepsis, only around half of them survive. So, as you can see, there are a lot of factors that go into mortality and the rate of babies dying because of sepsis. Finally, this is our citations. I hope you enjoyed our presentation and you learned something. Have a great day. Thank you.